This presentation will talk a little bit about what is a community care hub and who we are at Healthy Living for Me, different ways to join the Healthy Living for Me network, and the program overview, and then we'll have some discussion. This talks about our mission, and that's to coordinate and align community resources to improve the health and wellness of the people of Maine. I can't really say it better than that. And this vision is to help people to take control of their health and to access the resources that will give them the education that can help them build healthier lives. This describes, again, in detail what a community care hub is. We have a grant right now from the Administration for Community Living. It's a federal agency, and that allows us to offer some of the programs that I'll talk about. The community care hub, we have a number of different partners that we work with to provide these services. This talks about the benefits of a community care hub and the different functions that we offer. These are some of the services and programs that I hope that you'll find interesting. In particular, I wanted to highlight the chronic disease pain management on the right-hand side, diabetes management and prevention, and falls prevention. We've just relaunched the Maine Falls Prevention Coalition, and so we're doing a lot of work around that. These programs are evidence-based programs, and they are offered virtually and in person, and they we request a $20 donation to attend, but we never ever want that to be a barrier to attend. We want to get the information out to people as much as we can. Some of the other things that we're doing involves social care coordination, and that brings together all of the social care under one umbrella. And we've been doing some work with Aetna and CVS and Health Reach. So the other programs that we have are caregiving. Building Better Caregivers. I'm taking that program right now. It's really helpful. So if you are caring for an aging relative or somebody with a disability, it's an opportunity to get together and learn and have 6 weeks of connection with other people. And I am a caregiver, and I have found it invaluable, even having worked here. If you find that you need technology, you don't have access, we can loan a tablet so that you have the ability to do these sort of things. The chronic disease and pain management, these are what we call our toolkits, and we can mail you these programs and you can do it as an independent study if that is better for you. If you have a hard time getting to the class, or you're just a person that likes to study on your own, those are available in all of those forms. We also have one-on-one with a telephonic version, and I've taken this one. I didn't think I had a chronic condition, but I have migraines and a little bit of arthritis, and so that is a chronic condition, and I've taken it both as a trainer and as a participant. I found it very helpful, and it really made a difference for me. There's a number of different ways that we can deliver the diabetes management and prevention, and this lists them. Living Well with Diabetes, again, a great program, very helpful. Each of these programs, and I will show you our website where you can get some of this information as well. But this information, Living Well with Diabetes, Better Health Now with Diabetes, National Diabetes Prevention Programs are all different lengths and different methods of delivery. And they're all very helpful. Health Matters is another evidence-based program. It is for the members of the IDD community in intellectual disability and also acquired brain injury. And it is a very long program, about 26 weeks. It's been very well received. It really it starts very basic with what is nutrition, and then goes from there. It goes through label reading, all sorts of things. It also can be targeted to people with Alzheimer's or people with dementia, because starting over again. So this is a different audience that it addresses, but very, very helpful. Falls prevention is something that we're really interested in. We are offering Tai Chi for health and balance, and that's been proven to help prevent falls. Very popular class. Bingo size, everybody loves bingo size. There's prizes. There's the opportunity to learn while you're playing bingo, and then some very light exercise. But yet, it's still, when I did it, it still got my heart rate up. Very well received. A Matter of Balance is probably our most popular program, and that was actually developed, it's also evidence-based. It was developed through Maine Health, and it goes through some light exercise and a lot of education, particularly if somebody's experienced a fall and they start to be afraid to leave their house. It really goes through a group workshop with support and helps people see that it's better to get out into the community and continue to help them reduce the fear and increase their activity level, which in turn helps them stay healthy. Enhanced Fitness is a rolling program, and that can be in person or virtual. It's very low cost. Again, we never want cost to be a barrier. We have the ability to help people take the program regardless. So that's cardio, strength, balance, and flexibility. It, again, is very low, easy entry. So it's not one of those high aerobics where it's a little intimidating. It's very welcoming. Spoke a little bit about building better caregivers. That's the class I'm taking right now. I have found it enormously helpful. One of the most interesting things is how similar our experiences are and how supportive it feels to have other people experiencing what we are experiencing and to have that support. And a lot of very specific tools and techniques that help care for the people, especially with some difficult behaviors or some challenging behaviors. It's very helpful. Savvy Caregiver is a similar program to Building Better Caregivers. We have found that people have enjoyed Building Better Caregivers more, so we tend to offer that more often. Our audience is all Mainers, 18 years and older. They're caregivers, partners, family, and friends. When we talked about Health Matters, that program encourages the caregivers to attend with the person so they understand what the person is learning, and then they're able to support them. We find that if families and friends do it together, then it's a little more engaging that way as well. Inclusion and access, it's available in all the community settings. We're offering Tai Chi, for example, in an outdoor area in Clinton in the spring, so we're really looking forward to that. We use faith-based organizations, libraries, and then, of course, the online option. At the end of this, I'll switch over to our webpage and where you can access and get some information about this. And that particular, our webpage is HIPAA compliant, so you can go in there and feel really comfortable. And if you're a physician, you can refer people, or you can refer your friend, and you can go right into that program and feel comfortable. We do a survey before and after, and that's been very helpful to see what people are thinking about it. But all of the information is de-identified when it's sent in for the grant. And if you are uncomfortable in any way sharing this information, you don't have to. This is a story about the evidence-based program value. And these are testimonials where people have gone through them and what they've gotten from the program and how they've enjoyed them. The Healthy Living for Me database is also the data collection and coordination tool that allows us to start a workshop and you can go in there and register. We never want that to be a barrier, so you can just call and we can register you directly. You don't have to do it this way, but it's available should you choose to do that. Because these programs are all evidence-based, you can become trained as a leader and offer them. We found great success with that because you're offering, if you're teaching your peers and you're engaging with your own community. The programs, because they're evidence-based, are completely laid out. So, for example, if a nurse or a physical therapist teaches the program, we ask, well, they're required from a fidelity standpoint to not share their medical knowledge, but to rather follow the program. So that makes it consistent, and then it makes it easy for other people to be able to offer it as well. Delivery and host site are some of the ways that we can offer the program. So if you have a local library, for example, and you want them to host a site, that's one way to work with us. We can deliver the program. We can partner with the library and then train some of their volunteers and staff to offer the program, again, to be a part of the community. This is the website, and some of the things that I talked about, you can make, if you're a physician or a friend, you can make a referral. Even though this is for healthcare providers, it's very helpful. And then obviously the different, and also I just sent over, we're supporting a program called the Aging Brain. It'll be held at Vinyl Haven Library, and I sent you the flyer for that. So that's Thursday, April 25th. It's given by Susan Wary, Dr. Susan Wary. I don't know if it sounds like you've heard of Susan Wary. You know her.
She spoke at our elder care conference a few years ago. Yeah.
Fabulous.
She's wonderful. Right? Yeah, she's wonderful.
Very knowledgeable, very kind. And we're really excited about this series, and we're really excited to be able to bring that one to the island.
So the Tai Chi, do you do that online?
Yes, you can. We do that online.
Is that at a specific time, or could somebody just pick it up online anytime was convenient to them?
It's a specific program, so it will run through a specific time. And all of these programs on the website can be offered. Oh, thank you for putting up the Aging Brain. We're so excited about this talk. We can offer these programs whenever it's needed. So we just need to meet the fidelity requirements, which is we need to have a certain number of people to be able to offer the program. In Maine, because we're a rural state, it's usually 8. Other states have to have 10. So once we have 8 people, ideally a few more, so that we can, in case people drop out, that sort of thing. So 8 people can run, so we can start, if we get those people, we can start a program, we can start it online, or we can, if we have enough interest, we can find a place to offer it in person, as like we did in Clinton, for example, our outdoor opportunity through the Clinton Parks and Rec. That sound interesting, the Tai Chi? Everyone loves that.
Yeah, it does. I've always wanted to try that. But there's not that many people here, so we would never get 8 people.
So definitely we need to look for a online option. So we're very flexible and agile, so we can put something together fairly quickly. We've got a lot of training coming up, so if we know of anybody that is interested in getting training, right now we have our grant funding, which allows us to pay for some training. So that's also a possibility. But it sounds like we should start thinking about a Tai Chi online to meet your need.
We have somebody who's like 93, and then the next person down in age is 73, I think. So
that's a range.
Yeah. So I always joke on our elder care talks that, the elder care person, the demographic is now me. And well, my husband and my peers.
Your husband, I'm sorry, I missed part of what you said.
And my peers. It's now, we started going to this, I think I was in my 40s, but now I'm in my 60s. So So
Tai Chi has a lot of, we can offer, it can be altered to offer seated Tai Chi. So there's a lot of accommodations that can meet a broad range of abilities. And it's very, our Tai Chi instructors are very kind and I don't want to say slow, but careful and considerate and welcoming to all people.
And Cindy, we might be able to see if there are other people on some of the other islands who are interested and kind of make a cohort for virtual.
oh yeah, that might be nice. And I could see, you know, through the telemed equipment, I could probably put it up in the big hall.
Yeah.
You know,
although now, if it's virtual, people can do it wherever would make sense. So
that's true. But I think probably part of it is the camaraderie of being together to do it.
Yeah, that's true.
But
well,
also,
sorry, go ahead.
People don't always. I think people now are so used to doing things by themselves that, you know, maybe that's just how they would be more comfortable.
What we've done in a few cases is we've had a group that has gotten together and has come together in a particular, like a housing, for example. There was a housing area that they all joined through a video, but together in their conference room at their housing facility. So that's an option too, where a few people get together and then join and do, you know, 2 or 3 people do it, and then a few people are at another location and everybody's together, but there is some in person, if you will.
Mm-hmm. That's nice. Yeah, I don't know if anybody be interested, but it sounds interesting to me anyway.
Yeah, we can mention it to other folks and see if there's interest in try to make something happen if there is.
Yeah, it's very popular. We just did one in Freeport at the Freeport Parks and Rec, and they really loved the instructor, found her very kind, and few of them had expressed that they were a little bit intimidated by Tai Chi, and said that she was so welcoming and so gracious and really made sure they learned each move before moving on to the next one. So they really appreciated that.